Good afternoon, and thank you for joining us for an MP webinar covering ADA responding to accommodation requests. I'm Katie Kreider, Marketing Specialist here at MP. For those of you joining us on a webinar for the first time, MP is a full-service human capital management company. We offer a complete suite of products and services to support the entire employee lifecycle, including recruiting, HR, payroll, benefits administration, time and attendance, and compliance assistance. We support our clients with cutting-edge technical solutions, as well as proactive, reliable service and a deep HR and payroll expertise. At MP, we are wired for HR and help our clients succeed by aligning their people strategy with their business goals. I'm excited to introduce your presenter for today's program, Paul Corellis. Paul has over a decade of experience in the HR consulting space, working with businesses of all sizes and industries. Paul leads a team of SHRM-certified HR professionals at MP, and together they assist clients with compliance, training, and HR guidance and support for the full employee lifecycle. Paul also spearheads MP's employee retention tax credit services. This initiative has helped thousands of our clients claim over $100 million in refundable advanceable tax credits. And just a few housekeeping issues before we get started here today. If you would like to submit a question, please use the Q&A feature at the bottom of the screen. We will be sending out the recording of the webinar later today along with the slides. So with all of that, I'm going to hand the mic off to Paul.
Thanks so much, Katie. Hey, everybody. Certainly a hot topic. Over in the HR consulting side, we're seeing a ton with ADA, accommodation requests, and then probably even more complex just interactions between things like this and then either federal FMLA leave or state family medical leave, and all the potential fallout that occurs as those things interact. So I've got a ton to cover today, so I'm going to dig right into it without too much pontificating here. And certainly, as Katie said, feel free to throw questions into the Q&A on the Zoom. This is a pretty hearty presentation. We've got some quiz questions and things like that, so I may skip over a couple of slides for the sake of time, but with that being said, let's dig right in. So in terms of what we'll cover today, we'll go over some ADA basics, make sure we all have the same building blocks and foundational understanding of what the ADA is, and more importantly, maybe what it isn't. We'll talk about reasonable accommodations, what may be considered a reasonable accommodation, how to approach that conversation. We'll talk about a business and probably more importantly, a manager and supervisor's responsibility when it comes to recognizing what is considered a request for a reasonable accommodation. You'll see it doesn't always have to be said, with those specific words. We'll probably skip religious accommodations for today's session just for the sake of time, but certainly a topic we can cover at a future date, or if you have questions on that, feel free to reach out. We'll talk about when leave laws intersect. So I was mentioning previously, oftentimes something isn't as simple as strictly looking at it through the lens of the ADA. You're also having to consider federal leave laws, state leave laws, sometimes workers' compensation laws, state disability insurance, all that kind of stuff. So we will decipher all of that for you. And then finally, we'll go over some best practices as from a business standpoint, from a management standpoint, how to best handle the ADA when it applies to the workplace. So what is the ADA? Americans with Disabilities Act. It protects people with disabilities in terms of preventing them from being discriminated against in employment, as well as programs and activities offered by state and local governments, and then also accessing goods and services, stores, hotels, restaurants, doctors' offices, etc. I know there was recently a case against Domino's Pizza where it was said that their website was not compliant, it wasn't accessible. So things like that. So Title I of the Americans with Disabilities Act protects qualified individuals with disabilities, and we'll get into that definition next, from employment discrimination. Also prohibits employers from retaliating against anyone who asserts their rights under the Americans with Disabilities Act. And technically speaking, the federal ADA applies to employers that have 15 or more employees. That being said, we never advise or we never recommend as a best practice to not follow the ADA, even if you are smaller than that. But technically speaking, when you look at the law, it is triggered when you have 15 or more employees. So in terms of applications of the ADA when it comes to employment, it really affects all potential phases of the employment life cycle. So starting with recruitment before someone is actually employed by you, reviewing resumes, interviewing, offers, all of that, all protected by the ADA. Promotions, training, layoffs, reduction in force, you have to make sure you do those properly and not discriminatorily. Pay and compensation, termination of employment, job assignments. So if someone's transferred or, either to a different location or a different department, ADA may come into play there. Leave. So leaves of absence, vacation, sick, state or federal covered leave law programs, as well as benefits. So who is protected? This is sometimes the million-dollar question. The ADA's definition of a disability is someone with a physical or mental impairment that substantially limits a major life activity. Also protects folks who have a record of substantially limiting impairment, or, and this is an important one, people who are regarded as having a substantially limiting impairment. So among other things, this is something to key in on with your managers and supervisors. You want to be careful what you say, what you put in writing. If someone hasn't come forward, but we're using language like we suspect they have mental illness, or we suspect that they have this, that, or the other thing when it hasn't been announced by them or they haven't come forward with it, we want to be very careful that we're not handling employees in the workplace or regarding them as being disabled if they may not be, or if they haven't come forward and that hasn't been brought to light officially. So when it comes to what are those major life activities that would need to be limited for someone to be considered disabled under this law, some of those examples would be being unable to hear, being unable to speak, being able to adequately walk, think, perform manual tasks, vision, certainly when it comes to blindness, inability to breathe properly, inability to learn properly, issues with concentration, issues with being able to communicate, or being able to interact with others. So when someone has a medical condition, you'd look for it to make them unable or limit their ability to do one of these things on this list here, among others. So, as we said, some examples of a physical impairment: blindness, deafness, cancer, cerebral palsy, HIV, blindness, diabetes, epilepsy, MS, emphysema, muscular dystrophy. Diabetes is on there twice. So some mental illnesses or mental impairments that may be covered by the ADA. There's a long list of these. These are just a few of many potential, but it could include things like schizophrenia, certain learning disabilities, intellectual disabilities, and autism. So in terms of, aside from being disabled, what would they need to possess to be a qualified individual under the ADA? Again, whether they're an applicant or an employee of yours. So first, they must otherwise meet the job requirements. So if there's a certain level of education that's truly required for the position, not a nice to have, but a need to have, then they would need to meet that, as well as experience, skills, licensure, certification, whatever it may be. They have to otherwise be qualified to do the job and meet the requirements. And then you also have to make sure that they're able to perform the essential duties of the job with or without reasonable accommodation. So that's really where, especially with current employees as well as applicants, where you really have to see if that standard is met. And this really speaks to the importance of job description. So you really need to have a job description that lists out the essential functions of the job, so that whether it's a part of your interview process when you're speaking with applicants, or whether it's someone coming forward and saying, hey, I have a disability, I need an accommodation, that you can sit down with them and review those essential functions and go one by one and ensure, is this something that you can do with or without a reasonable accommodation? If they're unable to do it, then you are protected as an employer. So let's say you have a bus driver or a limousine driver and they go completely blind, or they get another medical condition where they're no longer licensed to drive. Obviously, someone in a driving position needs to be able to drive, and that's an essential function of that job. If they're unable to do it, then you most certainly have a case where you may not be able to provide an accommodation because one doesn't exist and that individual is not able to perform those essential functions. All right, so let's test your knowledge a little bit here. So first question, an individual does not have a disability under the ADA if he or she is A, an active alcoholic currently drinking, B, used unlawful drugs in the past and currently attends a 12-step program, C, used unlawful drugs in the past but is not in treatment now, or D, currently uses unlawful drugs or abuses prescription medication. So the answer here is D. The ADA does cover A, B, and C in most circumstances, but for an individual currently using illegal drugs or abusing prescriptions illegally, those folks are not necessarily covered by the Americans with Disabilities Act. All right, next one. Which of the following individuals would most likely be considered to have a disability under the ADA? A, kleptomaniac. B, an individual who is legally blind but can drive with glasses. C, an individual with advanced osteoporosis, or D, an individual who is pregnant. So a lot of potential good answers, I'd say, especially the last three. The correct answer is C. And to respond to a couple of the other options, B, if they can drive with some corrective lenses and there's equipment that can accommodate that and allow them to drive, then that is no longer necessarily a disability. And D, one big loophole in the ADA is pregnancy. Pregnancy in and of itself is not considered a disability, does not fall under the Americans with Disabilities Act. That said, several states and now the federal government has passed protections for pregnant workers. The federal law goes into effect this June, I believe it is. So it works very similarly to the ADA. We've touched upon it in some recent presentations. We'll definitely have some slides on it in our legislative update coming up this July. But if you need to know more about the Pregnant Workers Protection Act, please reach out to us. We'd be happy to speak to it, but runs very similarly to the ADA. All right. What should a manager tell an employee who asks why a coworker regularly leaves early when the manager knows the schedule is a reasonable accommodation? So should the manager respond with, mind your own business, count your blessings, he only has a schedule because he's sick, C, the schedule is an accommodation, or D, none of the above? So the answer here is D. You really need to make sure, both yourself as well as managers and supervisors, because they are agents of the company, so they're acting on behalf of the company, that they are only sharing ADA and accommodation information on a need-to-know basis. So you want to be mindful of employee protections and rights when it comes to matters dealing with disability. Okay. Which of the following would be a valid reason to deny accommodating an applicant or employee with a disability? A, the individual cannot perform the essential duties with or without an accommodation. B, the individual's disability results from current abuse of prescription medications. C, the only helpful accommodation is to provide the individual with a hearing aid, or D, all of the above. The answer here is D, all of the above. So we talked about, if they cannot perform the duties with or without an accommodation, that allows it. We talked about abuse of prescription medication as an opportunity to deny deny accommodation there, so that one's okay. And then C, businesses are not required to provide medical devices like hearing aids, glasses, things like that as part of a reasonable accommodation. So that's not considered a reasonable accommodation for the employer to provide those things. So all of the above in that sense. All right, so for the sake of time, we'll move on. Let's dig into what is an essential job function. So these are the basic job duties that an employee must be able to perform with or without a reasonable accommodation. So if you haven't yet and you're developing your job descriptions, or maybe you're reviewing them or reworking them, this is what your thought process should be, and perhaps your checklist should be when it comes to determining which of the tasks are essential and which are not. Number one, is the task necessary to perform the job? So again, the bus driver needs to be able to drive, yes. Do they necessarily need to be able to perform maintenance on the vehicle? Maybe not. How frequently is the task performed, or how much time is spent performing the task? So is this a major part of this position? Are they spending a significant amount of time on it, or is this just, a once in a while they may be required to perform a certain task that may not be essential? Could the task be redesigned or performed in another manner, or could it be reassigned to another employee? Big ones there. So again, for the driver example, could it be reworked so that if they're not able to maybe refuel the vehicle or perform maintenance on the vehicle, is that something that could be redesigned? Is it something that someone else could easily do that wouldn't really affect the main purpose and the prioritized or predominant tasks of the job? Okay. So obviously the job description, as we said, is a key piece, a key tool in determining essential functions of a job and ultimately what reasonable accommodations may be available. The EEOC is the federal governmental body that oversees the ADA and compliance with it. So in addition to the job description, some other factors that in cases the EEOC has considered: actual work experience of present or past employees in the job. So you want to make sure that your job descriptions are accurate to the job being performed and aren't doctored up to make certain things seem more important than they really are, or done more often than they really are. They'll also consider how much time is spent performing a certain function, and then what consequences might happen if the employee is not able to perform that function. Is it really essential to the company or to that position? All right, so I see a question here about reasonable accommodations. How does one determine if something is reasonable? It seems quite subjective. So yeah, it certainly can be. It's not necessarily a black and white thing, but let's talk about that a little bit. So at 10,000-foot view, a reasonable accommodation is defined as a modification or adjustment to a job, the work environment, or the way things usually are done that provides a qualified individual who has a disability and equal employment opportunity. So in terms of determining what's reasonable or not reasonable, ultimately it's whether or not that would cause an undue hardship on the business. And so that might be different from one business to another, and we'll talk about that next. But under the ADA, there are three aspects of employment where a reasonable accommodation may be required. A, to ensure equal opportunity in the application process, so before the person's even doing the job. To, if they are employed, to help them perform the essential functions. And then 3, to allow the employee to enjoy equal benefits and privileges of employment as the other employees receive. So when I talked about undue hardship a moment ago, the definition of that is something that would be unduly costly, extensive, substantial, or disruptive, or would otherwise fundamentally alter the nature of operation of the business. So if you're kind of finding yourself in the gray area where an employee is making an accommodation request, or you're trying to think of potential accommodations that could be made, Here are, among other things, 4 of the key factors that you want to consider. The cost of the accommodation. Is this purchasing a software, or is this, doing a major construction project in our facilities? Obviously far different in terms of a cost perspective. The size of the business. So, that really is factored in. I know some laws are very universal and hit small businesses harder than large businesses, but that is something that is factored in under the ADA. A 5, what might be an undue hardship on a 5-employee company might be reasonable for a 5,000 employee company, and that does get factored in. 3, the financial resources of the business. An expense that's affordable to one may not be affordable to another. That's another factor. And then the nature and structure of the operation. How disruptive would this accommodation be? Would it really disrupt the overall business operations? All right, so let's talk about accommodations in the application process. So this is an obligation that all employers have to accommodate applicants who have disabilities and are interested in employment. So some of these may include having an accessible interview location for people who have mobility issues. So if your office is on a 3rd floor and there's no elevator, you'd want to make an accommodation to meet this employee somewhere where they're not going to have to go up to that 3rd floor. It may involve some sort of interpreter, sign language, someone who is deaf or hard of hearing, providing a reader for an applicant who is blind, or, if you have pre-employment testing, some sort of modified testing for someone who has a qualified learning disability. So one thing you can really do to help yourselves as a employer who is hiring, definitely include information about the essential functions of the job and job advertisement. So it's great if you can really prioritize when you talk about the expectations of a job. Really, I always recommend putting them in prioritized order. So the most important and most common task first, and going from there. Also, not a bad idea to put in a statement. You see this a lot. I think it's more than lip service. I think it's always a best practice to have this in there, something like you see on the screen here, about being an equal opportunity employer and not discriminating based on any protected class. The federal government does have a great online resource called Ask Jan. So whether it be in the hiring and application process or trying to determine potential or what's a reasonable accommodation for a current employee, Ask Jan is a great governmental resource where you can pose questions and get a lot of great information. So we will be providing a copy of these slides. There's some links in there for various sections of Ask Jan. If it stands for the Job Accommodation Network. So when it comes to actual employees, as you can imagine, thinking about your own personal businesses that you're in charge of or in an HR function for, there are tons of possible reasonable accommodations that an employer might have to make, and that may be considered reasonable. So among those could be making adjustments to your existing facilities to make them more accessible, maybe to make them more accommodating to wheelchairs, let's say, things like that. Could be some job restructuring to take some of the non-essential functions of a job and place those elsewhere with other folks. It could be a modified work schedule for someone so that they can maybe receive cancer treatments or dialysis or whatever it may be. It could involve acquiring or modifying some equipment, maybe something that'll allow someone who has a hearing disability to be able to listen or be able to hear at a higher volume or something like that. It may be voice dictation software for someone who's unable to properly type. Could involve changing tests, training materials, or policies to make sure someone with a disability is able to adequately understand those things. Could involve providing qualified readers or interpreters in certain situations to accommodate certain disabilities. And it may also involve if there is a vacant position, so you don't necessarily need to create a position for somebody who's unable to perform essential functions of a certain job, but reassignment to a different position that already exists and is vacant could sometimes be considered a reasonable accommodation as well. So some things that are not, you don't have to worry about or you would not need to accommodate. Removing essential job functions again. So this driver can't drive, you know, they're out of luck, at least in terms of being a driver. You do not need to remove essential job functions from someone's role as an accommodation. You also don't need to create a new job or a new role for that person. You certainly can, but it's not expected of you under the ADA. And then again, as I said, I believe it was in one of the quiz questions, personal need items, glasses, mobility aids, hearing aids, things like that are not expected of employers as part of the ADA. All right, so we're going to talk a bit about the interactive process in a moment. So important to note, employees might come forward with some ideas for how they could best be accommodated, and that's great. But the interactive process is truly that. So you as an employer are not obligated to provide whatever the employee's preferred accommodation is. If you can come up with another reasonable accommodation or one exists, that would still allow them to perform the essential job function. So again, a lot of gray area there. ADA accommodation requests are really a case-by-case basis, but just know that it is truly an interactive process, and just because someone is disabled doesn't mean that they get to necessarily call all the shots. That's not what this law is about. It's about having an interactive conversation, taking a look at the essential functions of the job and whether or not a reasonable accommodation can be made. All right. So again, another important factor of the interactive process, if an employee makes an accommodation request that isn't reasonable, and we say no, it doesn't end there. We're not just then allowed to terminate. Again, the expectation and the phrase interactive process is truly interactive, and that's the expectation, as we've seen in recent case law and in the courts. If they came out with something outlandish or asking for way too much, but there is something reasonable you can come up with, it is really your duty and responsibility to propose something that you do find to be reasonable if their request is not. All right. So let's take a moment to talk about how to recognize requests for a reasonable accommodation. So as an employer, and again, this extends to your managers and supervisors too. So we highly recommend you get those folks trained up on this. So as an employer, you're obligated to provide reasonable accommodations to applicants with known disabilities unless their disability and the need for an accommodation is completely obvious to a reasonable, which is a dangerous word, employer, and it's the individual's responsibility to inform the employer of an accommodation needed. So in most cases, the employee is going to need to come forward and let you know that they have something that's impairing their abilities to do their job. Again, unless something is very obvious. And again, you want to be careful with what you say and what you presume, because that can come back to bite you as well. But in most cases, the individual does have to come forward. That being said, they do not have to come forward in a very formal way and say, hey, I've got osteoporosis and I need a reasonable accommodation. They do not need to use those terms, but if they come forward and say, hey, I have X medical condition and it's making it difficult for me to perform my job, I wanted to talk about what we might be able to do about that, then that would count. All right. So in a perfect world, you have an employee, they're performing well, and before it really becomes an issue, they come to you and they say, hey, I've just been diagnosed with XYZ disease. I'm going to need a modified schedule, and it's something that works well for your team and your business operations, and it's no problem. I wish every case was as simple as that, but for anyone who's been doing this for a while, you know that that is often not the case. Unfortunately, a lot of ADA cases come about as a result of performance issues and addressing those performance issues. So it may be that you sit someone down for maybe they have a bad performance review, or maybe you're giving them a verbal warning or a written warning. Maybe you're putting them on a performance improvement plan. Maybe you're terminating their employment. So oftentimes what will happen is you'll talk about their poor performance, and they'll mention disability as the reason for it. That does trigger your obligation to investigate and determine whether there are reasonable accommodations available. But we'll talk about what that doesn't mean as well. So in terms of how the law works or has worked recently, you're allowed to move forward with whatever action you've decided on prior to knowing about the disability. So let's say you've given someone a verbal warning, you've given them a written warning, you've put them on a performance improvement plan. There's been no mention or no assumption that there's any disability at play. The performance continues to suffer, and then you find yourself in a termination meeting and you let them know that that they're being terminated. At that moment, they then share, well, I've got this diagnosis, I've got this problem, and that's really why my performance has been bad. Because you've already made the commitment and made that employment decision, just because the facts are brought up at that time, because you've already made that call, you're technically allowed to move forward with that termination. You do not need to backtrack and say, oh, I'm sorry, I didn't know that. Let's scrap this whole thing and go through the interactive process. No, whatever it is, whether it's a warning, whether it's a PIP, whether it's a termination, again, if you want to, you certainly can, but by no means are you obligated to go back and change anything you've already decided upon once you find out about a potential disability. All right, so couple more quizzes for you. Alicia tells her supervisor, I'm having trouble getting to work at my scheduled starting time because of medical treatments I'm undergoing. Could this potentially be seen as an accommodation request? Yes, definitely. Number 2, Ben tells his supervisor, I need 6 weeks off to get treatment for a back problem. In this case, potentially, you would definitely go down that road, find out, what the back problem is, maybe have a fitness for duty involved, whatever it may be, but this is heading towards the path of potentially yes. Again, that's one that would interact with leave laws for sure. Charlene, who uses a wheelchair, began a new job today, and she informs the employer that her wheelchair can't fit under the desk in her office. Yes, this is a great, very black and white example of where there may be a reasonable accommodation that can accommodate Charlene to allow her to do her job once she can fit her wheelchair under her desk. Number 4, Derek tells his supervisor he'd like a new chair because his present one is uncomfortable. Based on the facts here, I would say no to this one. Certainly if he shares that he's got some spinal condition or whatever it may be, then that may become a yes, but based on the facts here, that would be a no. 6, a rumor is circulating that Frank just got diagnosed with PTSD. Again, this is a rumor. We're assuming it's from employees and not from management. We're not presuming anything, so this would also be a no. 7, Jenny's supervisor met with her today to evaluate her performance this year. She received a fair rating because her work is slower than her peers. Jenny explains to her supervisor that she's working slowly because of her MS that has progressed. So this would be a yes. Again, you can definitely stand by the performance evaluation and keep that on file as is. But going forward, once you know about it, you will want to start down that interactive process. Okay, so in terms of the role of managers and supervisors, make sure your supervisors are trained to recognize informal requests for accommodations. So coming forward and complaining about that condition that they have or a diagnosis they just received. Again, whether it's the harassment laws, the disability laws, the FMLA laws, whatever it is, your managers and supervisors are agents of the company. So what they know or don't know and what they do or don't do is what your business is doing or not doing or knowing or not knowing. So it's really, really important that your managers and supervisors are aware of this and don't necessarily need to know how to solve the problems or how to do the interactive process or how to define a reasonable accommodation. You just need to make sure they know who to talk to and who to pass that over to, whether it's HR or the leadership team or whatever it is. Just make sure they know how to recognize it and report it. And then you want to coach them. So while these can be difficult on a business, it's a great learning opportunity and coaching opportunity for your managers and supervisors to further develop them. So as appropriate, obviously, involve them in the process. Definitely encourage them if they brought this to your attention. So recognize work well done and use it as a learning opportunity. I think it might have been Henry Ford that said, the only thing worse than having managers that you train and leave is having ones that you don't train and stay. So make sure you invest in that training for your managers and supervisors. They're very critical to your organization. And while if done improperly, they can certainly be a liability. They can also be a huge asset. All right, so let's talk about intersection with leave laws. So sometimes this is referred to as the Bermuda Triangle of Employment. So the ADA, the FMLA, or probably more recently, state leave. So where I normally work out of Massachusetts, we've got the paid family medical leave. Other states have similar programs as well. And then also workers' compensation if they became disabled because of some workplace accident. That can also be a factor as well. All right, so quick overview of the FMLA. It provides up to 12 weeks of unpaid leave for specific reasons that an employee may have a serious health condition, oftentimes, but not always. Those serious health conditions will also fall under ADA protections as well. Important note, while the ADA is for 15 or more employees, FMLA, at least at the federal level, doesn't kick in unless you have 50 or more employees. So this may not apply to you if you're under 50 employees. But again, take a look at what states you have people working in. There may be state leave laws that apply to businesses of all sizes. So, and then as you probably know, workers' compensation is a form of insurance. It provides payment to employees who are injured or disabled on the job. There are a couple of states that have some opt-out programs, but as a rule, just about every employer of every size is required to have workers' compensation insurance coverage available to their employees. So whenever you have someone needing time off for any type of medical reason of their own or disability of their own, you want to make sure you're running through the full gamut of potential implications and potential laws and leave programs that may be involved. So as we said, sometimes you could have all three. You could have something that falls under ADA, FMLA, and workers' comp. So let's say someone is working with chemicals and there's an accident and something happens with their vision. That could certainly fall under all three of those simultaneously. So when you have a situation, determine which laws are potentially in effect. Is the injury work related? If it isn't, then you can throw out workers' comp. You don't have to worry about that. Is it a serious health condition? Then if so, it may be FMLA, excuse me, or it may be PFML, and depending on the state that you're in and what the definitions of a serious health condition are for that program. And then finally, does the condition meet the definition of disability under the ADA? So that'll kind of give you a better understanding of what you have to be compliant with. From there, you want to determine what the benefits or entitlements are under those laws. So it's FMLA, there's going to be some job protected leave there. If it's a state, if there's also a state in play, then that would provide the payment. and as well as job protected leave in most cases. If it's ADA, then it's more about accommodating the employee, whether that be for some defined time or some modifications to their position or some accommodations for their position. Once they're able to return to work, you want to make sure that they're eligible for reinstatement. You've got the necessary paperwork that you need, clearing them, letting you know what, if any, restrictions are there. And then lastly, you want to evaluate whether their return to work is going to pose a direct threat to themselves, safety-wise, or if others in the workplace, whether that be other employees, or if you're a business that's open to the public, whether it poses a threat to the public too. So we definitely want to accommodate and allow disabled individuals to work whenever possible, but that cannot come at the expense of that employee or your other employees or your customers. All right, so let's quickly go over an example here. We're doing okay for time. Alice, an assembly line worker, has called in sick for 3 days, citing extreme back pain. She's been with the ABC Manufacturing Company, who has over 500 employees, for 3 years, working full-time with very few absences. She calls in sick for the 4th day, stating she was examined by a doctor who took x-rays and stated that she needs complete bed rest and possibly back surgery, will be unable to work for an extended period of time. Alice states that her doctor thinks the condition is caused by the type of work she's been doing. So which employment laws are in play here? Certainly, it sounds like that back injury is going to affect some major life functions, so ADA seems relevant here. The ABC company has more than 50 employees. She's been employed for more than a year, full time. So it sounds like FMLA too, which could potentially provide up to 12 weeks. And then we're probably going to want to contact our workers' comp insurance provider to see whether or not they agree or whether they want to dispute the claim here that that the injury is work related. So it could be all 3 of those programs. Other laws that may come into play, again, state leave, depending on where Alice is working, and kind of leave it at that. When it comes to workers' comp, I always recommend getting your insured or your workers' comp company involved, or your agent that you work with. Those companies don't want to pay the claim any more than you do, so let them do the investigating, let them do the work. They're experts in that field, so it's hard enough trying to manage FMLA and ADA. Let the workers' comp people figure out the workers' comp, and certainly cooperate and provide anything they need to help them out, but I generally advise to leave workers' comp questions to the workers' comp people. So one important thing, and I like this graphic, and sometimes we can get things lost in the shuffle. When someone is missing time, missing work because of an injury or disability, you kind of have to weigh which programs are leave programs that protect their employment, where you need to return them to work potentially, need to avoid any type of retaliation, need to bring them back to an equivalent position, need to make sure there's a job for them when they are able, versus the pay type laws. So again, FMLA is the classic, yes, it's job protected leave, but there's no pay component. That's been changed through some of these state leave programs that provide both job protected leave as well as a monetary benefit. The ADA is not really either. Sometimes leave is considered an accommodation when it's very clearly defined, but the courts have been pretty clear that the ADA is not a unlimited paid leave entitlement. Another factor is if you have short-term or long-term disability insurance, those insurances are providing compensation, but they're not necessarily providing job protected leave if not applicable. So based on some EEOC guidance that's been released, a leave qualifies as a reasonable accommodation potentially when it's for the matter of enabling an employee to return to work. It at least needs to be a consideration. So As you'll see here, indefinite leaves where someone's badly disabled, it's unclear when or if they're going to be able to return to work. Extending job protection to that person is not considered reasonable. And there have been some recent court cases that have spoke to that. So indefinite leave is not reasonable, not something that's expected of you. But if there is a reasonable duration of leave, it's at least worth considering potentially, is that going to cause an undue hardship on the business? If not, it may be considered reasonable. All right, so let's talk about some 5 common ADA mistakes. 1, not realizing that a request for accommodation has been made, either because supervisors and managers are not communicating up the chain properly, or because someone didn't use that exact verbiage, but otherwise did state that they have a disability and need an accommodation. 2, permitting frontline supervisors and managers to evaluate accommodation requests. So again, unless they've been very formally trained or are working with an HR professional or legal counsel, you do not want those folks determining what is or isn't reasonable. 3, delaying a response to accommodation requests. So you don't want to let these things linger. Obviously, sometimes they may require some research or some questions or evaluation, but you do not want to sit on those for too long. 4, discontinuing the interactive process because a reasonable accommodation is not obvious. So again, there is, whether it's fair or not, a lot of onus is put on employers to really make some strong considerations and think long and hard and creatively when it comes to providing reasonable accommodation. And 5, inadequately documenting the entire accommodation process. So you want to make sure that you're taking good notes, you're properly filing, you're properly communicating with the employee in writing, whether an accommodation is approved, whether it's denied, whether you're proposing something different. You want to make sure that's all documented properly so that if things go sour, that you have everything, you have that paper trail of your good faith effort to be in compliance with the ADA. So as you can imagine, you need to be very careful in terms of questions you ask during the pre-employment or hiring process. So here are some questions that you can ask. So let's start off with the positive. You can go over the essential functions of the job and then say, can you perform any or all of these specific job functions? You can, as long as you do it for everyone and not single out people who appear to have a disability, you can ask them, please describe or demonstrate how you would perform a specific task. Can you meet the attendance requirements of the job? And what was your attendance record at your prior place of employment? Some questions that you may not ask. So this might be a more important list for you or the people invited in the hiring process, just to have in front of you to make sure you do not ask these questions. Do you have a handicap or do you have a disability? Do you have any job-related disability or limitations that would prevent you from doing the job? So again, you want to frame it as, here is the job. Is this something you'd be able to do with or without reasonable accommodation? Do not ask if you've ever received workers' comp. I actually just saw that on an application fairly recently. Have you ever been hospitalized or treated for a medical or mental condition? Have you ever been addicted to illegal drugs or treated for drug abuse or alcoholism? Or have you ever been absent from work due to illness? So these are all your no questions. Make sure these are not being asked either in an interview or on a job application. All right, so again, avoid making assumptions about a disability and how it may or may not impact the job. And really make sure that your criteria for judging performance and judging individuals is strictly on their ability to perform the essential job functions and not other disabilities that they may have, especially if they're unrelated to the job that they're tasked with or would be tasked with. Again, the Job Accommodation Network, JAN for short, is from the Department of Labor. It's a great resource, askjan.org. Doesn't replace the expertise of an HR professional by any means, but it is a great and free governmental tool that can at least lead you in the right direction when it comes to accommodations. So you want to make sure you've got proper policies, procedures in your practices. Make sure those managers, make sure your HR departments are handling accommodation requests properly, consistently. Be welcoming and careful with people when they come forward. Walk them through the process if someone comes forward. Sometimes it takes a lot of courage to for people to admit that they have a disability or something outside of their control is affecting their performance. So if they come forward with that, certainly be understanding and give them a heads up for how the process goes at your place of employment. And again, do make sure you document everything and communicate clearly too in a traceable way, preferably in writing with an employee throughout the process. All right, so it looks like we have some questions. Let's see how much we can get through before the top of the hour here. All right, so the first question is regarding physical disabilities and impairments, what about autoimmune? Yeah, so definitely folks with HIV, AIDS, other autoimmune disease, if it is affecting one of their major life functions, then they would definitely qualify for ADA protection. Let's see. Does a disability need to be medically supported and for an unlimited amount of time? Yeah, so you can definitely request supporting documentation for a condition. You can certainly, it's great if you have a job description and you can send that over to the doctor so that they can give you an informed response to say, based on what the essential functions of the job are, here's where this person's restrictions would be, or here's what here's where they would be limited or unable to perform a certain task. Great if you can get the job description in the hands of a medical professional. Is there a threshold for an undue hardship cost? So there isn't a mathematical definition for that or a threshold. Again, it really depends on the size and scope of the business. Again, a large business is going to be expected to accommodate more than a small one in many cases. Is there documentation required for pre-employment accommodations? Must we track those accommodations? Definitely good to track and note them. I would probably hesitate from requiring documentation, at an interview request. That might be a question for Ask Jan, honestly, but if someone says, hey, I've got this, I need this accommodation for the interview, I would probably just go with it. Again, it's for the interview process. Certainly, if you move forward with employment and they come on board, or whatever comes to light in the interview in terms of what accommodations they may need, then certainly it can go down that path. Excuse me. Can you discuss ADA accommodation for working remote requests? Any general guidance would be appreciated. Yeah, definitely. So this is a really hot topic, especially as employers are starting to, or have been for some time in some cases, calling people back to work who during the pandemic were allowed to work remotely. So, in terms of where work is done, it's completely reasonable and allowable for a business to say we want the work done on site. But there can be certain situations where an employee who has a legitimate disability and is for whatever reason unable or not medically cleared to work on site, and an accommodation may be that they work remotely. It's possible. I definitely think it's in some cases being abused by some folks. So you do want to go through the interactive process. Again, just because someone says I have X disability and my accommodation needs to be working from home, that doesn't necessarily have to be accepted by you. You do want to weigh in the factors, and again, take a look at the job description and what the essential functions of their job are. If there are things that really require their presence in the office or wherever it may be at client sites or whatever it is, then again, this is really on a case-by-case basis. There's no universal right or wrong answer here. There are sometimes situations where working remotely is a reasonable accommodation, and there have been cases that have gone to litigation where the courts have sided with the employer and said, no, they've made a strong case why, it really is a requirement or essential function of the job for this position to be in the office, to meet in person with someone, whether it be sharing physical designs or some sort of, in-person cooperation that's required as part of a job. It all depends on what those essential functions are. And, you know, COVID did kind of change the conversation a little bit because so many businesses had to get creative to stay afloat and found ways for the job to get done adequately remotely. So if the job was able to get done 100% as well remotely as in person, that might be a tougher argument for you for someone that has a legitimate disability. But if it's something where the quality of the work really deteriorated, or there were certain aspects of the job that couldn't be done, but you just did what you could remotely and sucked up, where things fell short or the things you couldn't do, but now you want to get back to doing those things, then you probably have a much stronger argument to not have to accommodate that. Can you request or require an employee to file an insurance claim for an accommodation before footing the bill for the accommodation as a company? So it really depends on what the accommodation is. Again, if it's, a personal device, a hearing aid, glasses, something like that, then certainly you're not obligated to foot that bill. If it's a piece of office equipment, most likely not. We have a question here about employees casually throwing out certain conditions, behavioral, mental health conditions, but not asking for an accommodation. That's really on a case-by-case basis. If they just talk about a condition that they have, but don't also speak to it affecting their performance or requiring something, then most likely not. The devil's in the details with these types of things, so it's really dependent on the situation, what exactly is said in those conversations or in those emails or whatever it may be. Looks like we have time for one or two more. Really great questions here. So we will, just if in case your question isn't answered, we will put together a Q&A document in the next few business days and send that out to everybody who registered, just so you know, if your question isn't answered, we will get to it in writing. But let's try to get to at least one more here. What about an employee that wants a specific chair that costs several $100s, that needs to hold a certain weight? Would that be considered reasonable? Not necessarily. Again, they might have a specific model and brand name that they want, but if you can find a more affordable chair that meets those same specifications and is going to accommodate their condition or their weight or whatever it may be, then you can say, no, we're not going to get the $400 chair. We've got this $200 chair that will be able to accommodate you and meet your needs. So that's our proposal. That's what we're willing to accommodate. All right. So again, we're running out of time here. Again, I know we had a lot to cover. Thank you so much. These are really, really good questions. We will get to these. We will send the responses out to everyone who registered. But for the sake of time, we have to cut it there. Again, really great topic. Maybe it's one we'll revisit again in the near future. If you do have other items related to this or other types of accommodations that you'd like covered in a future webinar series, please let us know. We want to make content that's relevant and valuable to you in the business community. So thank you again so much. I'll hand things back over to Katie to close us out.
Awesome. Thank you so much, Paul. To learn more about MP's full service solutions for 2023, handling ADA compliance, whatever it might be, you can visit our website at mp-hr.com. We also have a ton of resources available all the time. And be sure to join us next week for our upcoming webinar on unpacking the employee retention credit, funding for businesses impacted by COVID. So if your business was impacted by COVID, you may be eligible for those tax credits. So visit us, our website to register, and to see the full calendar of upcoming events and available resources. We will be sending out a recording of today's webinar along with the presentation slides this afternoon. Thanks for joining us and have a terrific day.